Hey, welcome back to Not So Complicated. Today we will be talking about loop diuretics along with other diuretics. So let's begin from introduction portion with a slight overview. Loop diuretics actually like furosemide and bumetanide are drugs used for heart failure, edema and then hypertension. Edema can be caused by many underlying diseases like cirrhosis, right? And they act on the kidneys loop of Henle to be specific thick ascending limb to promote massive diuresis. So the figure attached in here is the main key for the mechanism of action. Sodium potassium 2 chloride cotransporter. You can see that is what it is blocked, like these drugs block. So let's talk about that in detail. So they block sodium potassium 2 chloride cotransporter in the thick ascending limb, right? And thus they prevent reabsorption of sodium, potassium and chloride from the tubular lumen. So in the tubular lumen, what actually happens is that the concentration of sodium, potassium and chloride increases, and that is why they are excreted in urine. But these are electrolytes and they draw water wherever they go. So in like while getting excreted is an electrolyte, they also draw water osmotically, boosting urine output up to 25% of filtered sodium. So that is how massive diuresis is happening. So the other thing what these drugs do is that there is reduced ion reabsorption, right? Like sodium, potassium and chloride. So that will impair the counter current multiplier. So what is the function of counter current multiplier actually? So that is to maintain medullary osmotic gradient, right? So that is weakened because the counter current multiplier is weakening in here. So weakening the medullary osmotic gradient, decreasing as to reabsorption in the collecting duct and amplifying diuresis. So that is how diuresis is happening. So increased sodium delivery to the distal tubule enhances potassium and S plus excretion by aldosterone driven channels. This is like supplementary effects of these drugs, and that will lead to hypokalemia and then alkalosis. So these are the side effects of loop diuretics: hypokalemia and alkalosis. In like maximum in severe hypokalemia cases, you can use simultaneously potassium sparing diuretics to spare, to conserve, to retain potassium, right? So the physical and clinical effects of these drugs is that in physiological effects, that is increased diuresis 1 to 3 liter per day, that will lead to decrease in blood volume, so decreased preload in heart conditions, right? That will relieve heart. And in clinical thing, they will decrease edema, decrease blood pressure and relieve dyspnea, that is difficulty in breathing. Effects start within 30 minutes if it is given intravenously and lasts for 6 to 8 hours. And the manifestations are obviously decreased edema, lowered BP and improved breathing. So talking about confusion with thiazides and potassium sparing diuretics, we'll just talk about thiazide in one sentence. Thiazide diuretics like hydrochlorothiazide, they block NCC, that is sodium chloride channel in the distal tubule, causing milder diuresis than loop diuretics. And in potassium sparing diuretics like spironolactone, they block aldosterone and sparing potassium with minimal diuresis. So that is what these two group of drugs actually work. That is how they work. And the exam tip for this is that loop diuretics have the highest potency and thiazides have moderate potassium sparing, lead to potassium retention, right? So that is all about diuretics. Subscribe for more. Thank you for staying with me.